Basically, there's really no evidence to support that all the things we're doing are working. And because we still have a problem with falls, we're not seeing a decrease in falls. The problem, for example, with the beds, you have all this technology embedded into these beds, and you pay a lot of money for these hospital beds, and that the beds are able to alarm if the patient gets out of bed and to send a signal to the staff to say, hey, somebody got out of bed. The problem with that is, though, if I've got a patient in the bed and they're flip-flopping around in the bed a lot, maybe they have insomnia, maybe they're uncomfortable because of their pain, maybe they're positioning, but when they move around in that bed a lot, they're causing that bed alarm to go off. The nurse will go into the room and they'll see that the patient hasn't exited the bed and the patient's still there, they'll turn off the alarm. Well, if they keep doing that a couple times, what's happening is the nurses will go in and turn off the alarm because it's sending false alarms and it's making them stop what they're doing to go in there to turn off the alarm. So then what happens is the patient gets up, goes to the bathroom, and the bed doesn't alarm. So there's things out there, but unfortunately there's false alarms. The effectiveness of them just isn't there. And so that's why we're having these inconsistent results with fall prevention. Somebody just sitting in that room with them for 24/7. So 24 hours, 7 days a week. That somebody sitting in that room, watching that patient and making sure we keep them safe. That's how important it is for hospitals to keep people safe. So there may be patients that are suicidal, somebody that's a behavioral risk patient, somebody that might be trying to pull out some NG tubes, IV lines, different things. So at any given time, you're going to have probably a half dozen to a dozen different patients that have a sitter in their room just sitting in there observing them just to make sure they're safe and they don't hurt themselves. If you have one sitter 24/7 around the clock for 24/7, you need 4.2 FTEs for one person 24/7.